Welcome to Politics Done Right. My name is Egberto. Willies, your host. Good morning, Houston. Good morning, Harris County. Good morning to the great state of Texas. Good morning to the great country, the United States of America. Good morning to the rest of the world. Good morning to every nook and cranny where this 100,000 watt signals of our transmitter, that transmitter that our listeners support, likely one of the only transmitters supported solely by our listeners, and a big one at that. Welcome aboard Northeast and Southeast Texas, Northwest and Southwest Louisiana. Welcome aboard, and of course, welcome to every place that listens to us over the internet. We got a great show for you today, as usual. But before we get started, let's get busy because first tips always go to our geniuses in the studio. Buenos dias, mi gente. Good morning,
And
my
that
people.
transmitter is and that transmitter is working hard for us too. But I don't even know what a cranny is. You say it reaches every nook and cranny. What is a cranny?
I
Jack?
just say,
Yeah,
I
I
don't
know what a
know.
cranny is. It's that thing at the top of your legs.
I hear you, buddy. I hear you.
I don't really think that's it, but okay.
Well, it's
Hey,
small spaces of crannies.
Oh, okay. There we go. Now, I thought a nook was a small space too. But anyway, aside from all of this nonsense,
Funny humor.
we have a great show for you today. Also, I wanted to let Harry know that we're going to be repeating Arnie Arneson at noon today for a while. We'll see about our noon show has dropped off. So we're going to do Arnie Arneson. So he'll be interested in, if he missed any of it, he'll be interested in listening in. And they were talking about Project 2025 this morning, and Arnie was
wow.
cringing.
Oh,
So,
yeah.
and everybody else should cringe too. I was listening to the Lincoln Mitchell Minute, and the Republican Party is dead. It's gone. It's the Trump Party now. So I don't know how this managed to happen, but it has. And the Republican Party, as we knew it, is no longer. So folks who, if you're a former Republican, you're now an independent. If you're a former Republican with a brain, you're an independent. If you're a Republican without a brain, you're a Trumper. So there you go.
All right. So said Howard Reynolds. But anyway, what do we have from the one and only Jacques? And it's not Jacques Cousteau, but it's Jacques Van Beba.
It's better than Jacques Cousteau.
I
Jacques
know.
Cousteau is no longer with us.
He was a good man. I
Yeah,
watched
Yeah.
his stuff.
yeah, I did too.
Okay.
Believe it or not, guys, I watched Jacques Cousteau in Spanish in Panama. It was funny. I didn't even know what the guy sound like. It's like watching Bonanza. We watched Bonanza in Spanish, right? And the first time I heard Haas's voice, I'm like, oh, that's what it sounds like.
Oh Lord.
He was French.
Yeah. Oh,
Well, it's Jose in
oh, that's
French.
what it is. Okay,
Yeah.
okay. Anyway,
All right.
Jack, what you got for us?
I'm gonna talk about Gaza here for a minute. Uh, the genocide in Gaza can be laid at the feet of big oil, and Netanyahu is the tool big oil is using to kill or remove the Palestinian from Gaza, so big oil can drill, drill, drill. And this port they want to build to deliver food, that's a cover story. More likely, the port will be built as a part of the oil extraction infrastructure. Don't be fooled. If they're successful at removing the Palestinian in 10 years, Gaza will be full of drilling platforms, wellheads, and pump jacks, maybe a refinery too or 20. Who owns the mineral rights to the oil under Gaza? Connect the dots.
Let me just first say for our audience at large, while I have absolutely no information that specifically say that, that from many sources, that is a lot of information going on, not only about the hydrocarbons that are there but never explored because, of course, they don't want that cash going to Gaza. And second, there is also something known as the alternative to the Suez Canal. I think it's called a Van Giat or something like that that's been on the books for a while. So, while we don't have fact-based information to give our people right now, we'd like folks to know exactly those items that you hear Jack mention. A lot of that is in the ethos. You may want to ask, how comes there are not a whole lot of drilling wells in Gaza, given that there is in fact hydrocarbons under there? Guess what? They don't want that money going to the Palestinians. It would make them a fairly self-sufficient state given the oil versus population size. So, I can see that. Anyway, anything else we got before we get into el programa?
No, go for it.
All right, let's go for it. Hey guys, look, I actually have and let's see, what time is it? 8:05. I will be starting early, so I think I can do this. I have an interview of a woman who has lupus and got shingles and who had issues with the state. So let's go ahead and play that interview. It's a 19-minute interview, and then we'll move on from there. So let's get busy, folks. And after that, give us a call, 713-526-5738. Again, that is 713-526-5738. Remember, for whatever we don't cover today, you can go to politicsdoneright.com/newsletter. Politicsdoneright.com/newsletter. Here we go. Welcome to one more edition of Politics Done Right. I'm Egberto, Willies, your host. Thank you so kindly for being with us. Today we have a very special guest. As you know, one of my passions is healthcare, and not only healthcare, but how it is financed and how it is handled. Well, today we have a special person, Elizabeth Townsend. Elizabeth Townsend is a political consultant among other professions. So, Elizabeth, welcome to Politics Done Right. How are you doing this afternoon?
I am doing great, Egberto. How are you doing?
I am doing great. Earl, I met you via the Bill Birch campaign. You worked for Bill as he ran for Railroad Commission. I think that is a race I was hoping somebody as knowledgeable as he would win the Democratic primary and take it all the way, because you represented somebody that really knew what he was talking about.
Thank you. Thank you for the kind words. Yes, he is very knowledgeable. He's an expert. He is a true Democrat, and he really wanted to be up there. But, there's always the next election. So if he's listening.
There you go. You better go for the next election. But anyway, one of the reasons I wanted to talk to you is earlier we were talking about my wife having lupus and at the same time having gotten shingles. And it's such a coincidence that here is somebody that I recently spoke to as we worked together, and we put Bill Birch on. You got him on one of my shows, and here it is. You suffered the same fate. First of all, tell me a little bit about your lupus. How long have you known that you had lupus?
I've known since 2017.
That you've had lupus. Okay. Yeah. So it's about 7 years or so that you've known. And
Yes. Because that's when I was finally diagnosed. It took forever to get a diagnosis. It took years.
It is sad because it is one of those diseases that don't have a clear marker. It's a list of things that tells you, well, if you have these list of things, then we're going to classify this as lupus. There's not a lupus gene or a lupus thing they know about quite yet, at least.
Well, there's a couple of tests that can be done. I forgot what the letters for
the ANA markers.
Yes, the ANA markers. So I had a couple of those, and then I responded to treatment, and so because I responded to treatment and there were the markers, they're like, okay, it has to be lupus, and plus her immune system is constantly just overactive.
Right.
And the last time I was in the hospital, I was there for 2 weeks, and I was getting blood transfusions because my red blood cells had depleted completely, and I had no potassium due to too much hydroxychloroquine in my system. And this was right before COVID happened. So.
Oh, yeah. But anyway, so let's talk about how you handle it. First of all, had you had insurance at the time of your diagnosis?
No. Typical story of going in and out of the hospital, getting the treatment, getting a Band-Aid put on the situation, getting bills for $50,000 because I had to be kept in for a week for a blood transfusion.
Right.
or I had like my system was just overactive with an infection, like shingles.
Right.
Then they had to keep me. Here comes another $50,000 bill. So I had applied a couple of times to the state for Medicare and Medicaid because I've put money into the system, and I actually honestly believed when it tells you on the application, hey, if you're struggling and you make this much income, go ahead and apply. We'll help you, right? And I'm thinking my state's going to take care of me, right? No, I was denied and basically told that I had to sue the state in order.
Before we go to the suing of the state, you were in that sweet spot where you made too much to qualify for the basic Medicaid, but you didn't make enough to be, nobody would take you as an insurance person. I mean, for insurance because you had a pre-existing condition back. Well, that is after Obamacare. So Obamacare would have been expensive, but you could have got it. But it is sad that you can be in that sweet spot that because we as a state have not accepted the Medicaid expansion to the Affordable Care Act, it doesn't take care of you. So continue with that for me.
They say that there's no money, yet there was $1 trillion offered to the state of Texas.
Right.
And Greg Abbott decided to say no and play political games with people's lives. And I think that
your life. And the reason I want to specify your life is because people look at these things in an esoteric manner. Sometimes they look at it as if it doesn't really affect people. You were one human being with lupus. You needed care. The people in the state of Texas have already paid taxes into the system. And because Greg Abbott and the GOP refused to accept that from the federal government, your life was in danger.
Correct. Because he wanted to say he saved money and took people off of welfare and benefits and stuff like that so he could run on that platform as governor. You know, like people die because of these decisions. And these are Texans. These are our fellow Texans. I mean, it's easy to get lost in being able to be taken care of and having a home and having all your basic necessities met. But there is a whole large population of people who are destitute, who are disabled because they cannot get the care they need because they cannot reasonably justify saving their life and their health to the state of Texas.
Let's be clear here, Liz, because I want folks to understand. Were you ever somebody that didn't want to work and carry on and do what you needed to do?
Yes. I mean,
aren't you somebody that paid into the system for decades?
Yes, I paid into the system. I've been working since I was 15. I really believed, okay, I'm in a bad situation. I need the help. The wording on the application makes it seem like, oh, I'm going to get help. No, there's a whole lot of red tape. Every legislative session, it seems like funding is reduced even further, or there's some convoluted rule that needs to be added in to try to disqualify another group of people.
Even as we have in Texas a huge surplus because we don't take care of our own people. We don't take our tax dollars and take care of our own people. I repeat though, Liz, you are not a burden on Texas. You are somebody who has paid your dues in Texas, whether it be employment, whether it be purchasing at your grocery store where you have paid sale taxes and many other taxes, whether it's be renting a home or owning a home where you have paid those taxes, you have been an active participant in this society. The reason I'm saying this above your statement, Liz, is because too often, and a responsible government tries to make those who are saying, I need some support for the state temporarily now, they would make one feel as if they are making an unreasonable request or they are less than, which isn't so. We are all participants in this society, and we all make it run. Now, when you found out you applied for assistance to get healthcare, and folks, let's be clear: when she got $50,000 medical bills, those were high level theft. But we'll take that another time. Let's go ahead and talk about what you had to do to get some sort of healthcare.
It was very difficult because I was in and out of the hospital, in and out of the ER, spending a couple of days here and there. Meanwhile, I'm doing all this paperwork, and it got to the point where I had been denied twice, and my appeal had been denied. And then they told me that I can, do another appeal, but with like in a court situation,
right,
where basically I would be suing the state, where I got a lawyer and I sue the state, saying, "Hey, I justifiably am reasonably
disabled.
My life is worth saving." Side note, I'm very worried about the future of it, considering like women's rights and the rights of disabled in the future, and the wording that comes out later, but and how they're going to use that to take people off of the benefits. But it just felt so low having to tell my state, yeah, my life is worth saving. Like, what about me? What about all these other people, all these other Texans who pay taxes, who pay into the system, love their state, love their neighbor, are good citizens? Why aren't they valued by the system? And it really told me that, you know what, the state, well, not really the state, it is our leaders don't give a damn. Greg Abbott does not give a damn about anybody except himself. And I know that's hard for a lot of people to digest. It's not the state, it's the people running the state and writing the legislation to purposely hurt and undermine marginalized communities. I mean, like having to sit there and have a judge be like, well, did you pay enough into the system to justify having this $1,000 medication given to you so you could live? And you have a lawyer defending you. And of course, the lawyers take a big chunk. I think my lawyer took about like 45 to almost 50% of back.
The back pay from the disability that they didn't pay you for all those years.
Correct. So there's a whole industry behind that. There's a whole industry of lawyers that are making money off of people's misery and desperation.
And you know what is so interesting? And I wish somebody would do an investigation on that to see how many of these lawyers are tied to the state, meaning the state justifiably denies so that they ultimately will then approve, and the people who help you get approved make a cut of the state's money, because that's exactly what just happened, right? Your lawyer took about 50% of your back disability, which means the state, a lot of the money that would have been apportioned to you now went to a lawyer. And most of these lawyers are, in fact, connected to the state.
Correct.
And Americans need to see this. What we need, of course, is healthcare for all. So ultimately, you won your case for disability. Yes. And how does that work now? I imagine you got Medicaid and Medicaid or Medicare so that you could actually get healthcare.
Or there was some adjustments and different changes to the laws just as Trump was coming and starting to affect the laws. I was able to get into the system before I was basically disqualified.
Right.
So what they do is they go to look at your medical history and your bills, so hospitals have a way of benefiting off this as well, because now those $1,000 bills went to the state.
Right.
And so because I was declared disabled back years before, they were able to be paid taxpayer money, which I thought was like, hey, that's not fair. They shouldn't have charged $50,000 to begin with.
But
And
now
then
they can bill the state for $50,000.
exactly. So these private entity hospitals have something to benefit off of the disabled as well, off of people who are going through this process. And so it's like they have an incentive to help people get on Medicaid and Medicare.
It is sad because all around, all of this stuff is so simple, right? All we have to do is have healthcare for all, that is needs based or income based. Because a teacher with 4 kids may not be able to afford insurance, but they are so valuable to society. We want to make sure that they have healthcare, so we should have a disposable income based way in which we allocate health insurance. I mean, there's so many things that we can do to make things better for people.
Yeah, because I mean, the writing and what we're sold and what we're told is that if we're in a desperate situation, if you're a good citizen, you pay into your Medicare and your Medicaid taxes, and you pay your taxes well, the state will be there to catch you when you fall, right?
Right. It should be.
No,
It should be.
the state is there to catch you all right, but it's more like a web.
Right. That you fall right through. Well, look, let me just tell you. After you told me your story about having lupus, having issues with insurance, etc., I wanted to get you on so that our audience can hear real stories about what's happening to real people in the community and why, just to start, we need to get the Medicaid expansion to the Affordable Care so that people won't have to go through what you had, because the time delay, the times that you had to deny yourself health care made you sicker. Anytime you are thinking about, I can't go to the doctor because what if, it makes you sicker, and that is a stress on your life. So the first.
Many people have some debilitating illness that is affecting their ability to survive, to have a job, to be able to put food on the table and keep a roof over their head, to have the most basic needs of like Maslow's hierarchy, that it just boggles my mind that, I mean, even pharmaceutical companies have a benefit off of this because there's no negotiating price with the state. They can just charge whatever they want.
Well,
and that ends up putting a strain on the taxpayers. And then they start saying, well, it's because these people are getting benefits from the state, we need to raise taxes. No, that's not the problem. That's not the problem. The problem is this late stage corporate
greed.
Yes.
That's what it is. Corporate greed, and it's a constancy of taking more and more from all of us. They don't accept it that they're the parasites. They are the welfare queens and kings.
Yes.
They are the parasites, not us. They are the parasites. They are the one that suck on everything we do, both from our labor, our work, as well as our monies. That's what they do. So anyway, let me tell you, I want to thank you first of all for talking to me about your lupus, your healthcare situation, and folks that are listening. Remember, we're not just about talking about problems. The reason I'm bringing you these issues is so that you know that you are already empowered. Just like Liz was empowered to go ahead and fight for her rights, we need to fight as a collective, so that Liz doesn't have to go out there and hire a lawyer who takes 50%, but we empower and put people in power that are actually going to pass the laws appropriately so that we all have the appropriate health care. Liz, give me a 30-second closer.
Yes, you get to a point where you wonder, how can you're facing a behemoth of a system that does not work for you. Everyone working together can affect change. Please register to vote, get out and vote. You might think you're just one little person. That's what they want you to think. You are valued. You are worth something. So to those who are disabled or are struggling, please get out and vote. I know it seems like moving a mountain, but we can do it together.
Get out there and vote, but not only vote, but vote your interests. Vote your economic interests, vote your healthcare interests, vote your social interests, vote your educational interests. Liz, Liz Townsend, Elizabeth Townsend, thank you so kindly for having been on Politics Done Right.
Thank you so much. And thank you so much for your support, especially with the campaign. We really appreciate it. And education is the key to getting folks to be active citizens.
I really wanted to interview her, and let me tell you other people that I want to interview. If you are out there with a medical situation where you've either been successful in fighting the system, whether you are fighting the system, or whether you think you need to fight the system, please contact me, kpft at politicsdoneright.com. kpft at politicsdoneright.com. One of the ways we make change is for people to understand that they are not alone, that they're not, a lot of people, because when you're talking about health issues and certain issues that affect you, you sit back down in your home and you sit back thinking there's something special about your situation. You are going through this alone, and that is what they depend on. That is what the system depends on. It depends on you thinking you don't have an alternative, and then you keep quiet. I want to hear your stories. I want to tell your stories. I want you to tell your stories. And this is your platform to do just that. Just like Elizabeth did, I want to hear from you. KPFT at politicsdoneright.com. Before I go to the phones, I want to tell another quick story. I got a call from a dear friend yesterday. His wife is in dire straits, and she decided to take Medicare Advantage. And they thought all was good for all these years. Well, she came down with a severe back problem where now she cannot walk. She needs therapy and all of that. She was in the hospital all week last week, and they said, okay, now we need to release her to rehab. There is a specific close by rehab place that they wanted to use because it has good qualifications, etc. Their insurance company denied the coverage. They called, they asked, they denied the coverage. They appealed, they denied the coverage. All of this happened over the period of several days. Then now they're in dire straits. They asked the Medicare Advantage people, what can we do? What can we do? And they said, okay, here are the different alternatives that you have. You can select this place. They go ahead and they select the particular place recommended then by Medicare Advantage. The place takes them after day 4. They call them up and say, we got to let her go because they denied further access. They denied the use of our clinics to rehabilitate your wife. So he's in limbo now, not knowing what to do. So he went out of pocket and he paid for 3 or 4 more days so that they could go ahead and work with Medicare to see what they could come up with. Finally, the head of the person said, look, what you really need to do is go and get traditional Medicare. You won't have any of these problems at all that you're currently having with Medicare Advantage. He called me last night almost crying. He said, and they can't sign up for Medicare Advantage, I think, till the beginning of the month or something like that to make the changeover. So, and then I said, the only problem that you're going to have, my friend, is that because you're going to be going for that Medigap while you have a pre-existing condition, the price is probably going to be unbearable, but you still probably need to change to Medicare Advantage. The 20%, well, got to throw our hands up in the air because your wife does need the care. And then he said, Egberto, do you know of any, how can we get better advice? I'm like, you know what? I've been talking about this so much. We need to create a place that we can start giving advice to people on what to do and how to fight these criminals that are administering Medicare Advantage. First of all, by all means, if you can avoid Medicare Advantage, you should stick with traditional Medicare. If you're still healthy and are on Medicare Advantage, switch to Medicare, standard Medicare. Remember a few days ago, I said there is no doctor that has been polled. There are several polls that went ahead and asked doctors, would you take Medicare Advantage or Medicare? Not one doctor said they would go for Medicare Advantage. Not one doctor. I'm on this spiel, folks, because I understand what the corporatocracy is doing to our healthcare system, what it is doing ultimately to you, the bells and whistles that you see, the free drive to the hospital, the groceries, the club membership, they are all facades. Because ultimately, as you have to get care, as you ask for permission for care, you're denied. Last night, I'm writing this show when I got the call from the friend. I mean, and he was in tears, almost in tears, as he explained in the situation that has been going on for weeks now, fighting with to get his wife care via Medicare. Denial, 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 denial. And you read the New York Times, you see that it is standard modus operandi when there is something really, really wrong. I can't urge you and tell you enough of not accepting the bells and whistles. It's almost as bad as listening to certain politicians give you the bright lights that ultimately is just a cover. Like I told Liz, vote your interests and vote your interests as well when you're choosing the Medicare you're going to get. All right, let's go to Augie. Come on in, Augie.
Good morning. So about Jacques Cousteau, they filmed an episode here in Texas in Galveston,
I didn't know
and
that.
yeah, a friend of mine had a scuba and gun shop, and Jacques Cousteau needed a particular scuba tank, and the only place in Texas was my friend's store. So he came over here to Houston to get that scuba gear, and then when the episode had to be filmed, he had an attractive model that was going to be in it, but she was sick on the day of the filming. So my friend got to be in the episode with him. So, but yeah, Jacques Cousteau came to Texas one time and filmed an episode here.
That
But
is
as
so
far as
great.
yeah, yeah. But as far as this medical care, it's not just medical; it's also mental health care too. And when we haven't had a good governor since Ann Richards. When George W. became governor, the second week he was here, he went before the state house and said, "Hey, man, I saved the state a whole bunch of money, like 50,000 or I forget how much, by shutting down a nationally recognized mental health care facility in Tyler, Texas." And he shut it down, and that's the beginning of shutting down mental health care all across the state. Just a few months ago, a hospital here had a mental ward, but they shut it down because lack of funding from the state. And I've talked to some Republicans who have children that have mental health problems, but they cannot find anybody that can take them because there's less and less every year because Republicans keep shutting down mental health care and not just medical care. And if people are really interested, when the Affordable Care Act, and they had a lot of people come before the Senate because they held a hearing. And if you looked on C-SPAN, I just happened to be home by accident, seeing channels and saw C-SPAN and saw the actual hearings. There were no news commentators from NBC, ABC, or anything. It was the hearing of the people saying how bad our medical care here was. And that was when Obama was president, and he was trying to put the affordable haircut. There was a woman who worked for 30 years, and she had her company insurance, and she's getting ready to retire. And for 30 years, she paid into the company's medical insurance. But now she's getting ready to retire, and she's diagnosed with cancer. Well, when she goes to put her claim in, they go check into her medical records and found out she had a pre-existing condition. When she was a teenager, she had acne, which a lot of teenagers have, and they used that as saying a pre-existing condition, and denied her cancer care. And but she wasn't the lady that testified; it was her sister. She didn't testify because she died from cancer because she couldn't get that medical care here that that she needed. And there were a lot of other horror stories too besides
That
her.
Augie,
And
you're so right about all these horror stories here in Texas, largely because even now they can't deny you because of pre-existing conditions, but they can still make your life very difficult, as my friend is finally seeing right now. He said one of the reasons they denied her coverage was because they had some paperwork that said she was supposed to have rehab at some other time and didn't go for rehab. I mean, it's amazing the things that they have in fine print that in ways to find ways to deny you coverage. We can't allow that. But I have more calls, Augie, so I need to run and pick up Harry and then William. So thank you so kindly for calling in as usual, my brother. Always with some wisdom. All right.
Well, you take care and keep it up. Right.
Thank you,
Bye-bye.
brother. Let's go to Harry. Come on in, Harry. How are you doing this morning?
Good morning, panel, and love your stories. Augie, as usual, you always have something intelligent and enlightening to bring to the table. I love Jacques Cousteau, too. I used to watch that when I was a kid, and I loved Mutual, Omaha, Nebraska, all that stuff. So I'm glad you guys talked about that at the beginning of the show. But, yeah, your friend, Egberto, and Liz, we got to vote in more people who think like Bernie Sanders. We have to vote in more people who think like Mark Pocat. That will try that is trying to get rid of Medicare Advantage, suppress that, and strengthen regular Medicare. And we must vote in more progressives so we can get what Bernie Sanders has been talking about for years, a single payer system to help people like Liz and your friend Egberto. That's what we got
You're
to have.
Harry, you're absolutely right. There is no two ways or there are no two solutions. You cannot have fee for service because when you have fee for service, it actually means that ultimately speaking, they must keep you sick or deny you coverage if you don't have somebody paying the bill. Harry, I got to go to Williams. So give me a quick closer.
Can I say one more thing? Yeah, I'll give you a closer. Shout out to Howard. Thanks for playing Caravan Dreams with Peter White. You play that a lot. But I did ask you, I think about a week ago, when you find that Peter White song, Don't Wait for Me, and play that before Politics on the Right gets started, either next week or when it's most convenient.
Man,
And you
Harry,
guys,
You are so demanding. You're
well,
our
listen,
you're
I love
our
Peter White.
brother. Are you kidding me? You're our
Oh,
brother,
yeah.
man. You're like the dean.
I
Anyway,
know
thank you
Howard will
very much.
find Howard will find it. You guys have a good weekend.
Thank you, brother. You have a great weekend. Let's go to William. Come on in, William.
Howdy, Pilgrim. I
Uh, gr-
tried you a few days ago. I had my phone, had phone issues. But anyway, I have a great motto for. Well, let me back up. Thank you for being vertical. I like this program, but I don't agree with everything. Of course not. But anyway, I have a great motto for you. It applies to everything. Really. I'm not sure where I first heard this, but it's a quote. I just can't tell you who it was. But anyway, how's it go? The swift wind of compromise is more devastating than a misfortune. I'm really disappointed mostly that we're down to these two clowns again for running for president. Please tell me someone else is going to step up to the plate. You know,
uh,
um,
William, unfortunately, I can't tell you that somebody else is going to step up to the plate. The way these
mm,
parties have arranged the system, it is, and I'm talking about all with the two
scary.
major parties, it's rigged. But here's what I can tell you to make you feel better, I hope, right? When you're voting for the president, just think about you are voting for somebody who's going to sign the bills for all those other people, those other good people that you are going to vote into office that are going to write the bills. Remember what we learned in school, the executive, the
Right.
judiciary,
It,
and the
it starts
legislative.
it starts
Go.
before the head guy. Yeah.
Yes, right. So what I'm saying is, while we are hooked with these two guys that none of us want, right? remember that there is a whole lot of stuff underneath from the state level to the federal level that you're going to vote for. Research them, Brother William. Research them.
Right.
Talk to other people about them. Talk to us about them. And then let's make the appropriate choice because they will tell Brother Biden what he will sign. All right?
Vaya con Dios, Timo Sabe.
Gracias, amigo. You have a wonderful rest of your day, sir. Let's go to Patrick real quick. Patrick, you're on, Patrick.
Hey, good morning. Hey,
Good morning,
I
sir.
respect Augie, and hey, good morning. I respect Augie. He seems like a great person, well read. But I have to actually point out that he made the first mistake that I've heard him make today. We didn't get rid of the mental health system. We transferred it to the correctional institute. At the
Oh, wow. Oh my God. You know something, Patrick? Patrick. That is deep and sad, but that is deep. In effect, we've turned our jails into the hell where we throw people with mental problems. Man, that is interesting what you just said, dear my friend. You know what else is interesting, Patrick, is that remember when we have all these mass killings and all these people are found to be mentally ill, and when we say we want gun control, better gun control, etc., the right wing comes out and says we don't need any more gun control or controlling the weapons. What we need is these people is mental health care. At the same time, they're cutting the mental budgets and doing exactly what you say, and that's throwing it over to the jails. Isn't that amazing?
yeah, it's
Patrick?
becoming. Yes, sir. Can you hear me?
Yes, I hear you.
Okay, yeah, it's become a trend in the last 10 years or so. Anybody that needs help in the United States, we criminalize them.
Yeah, it is sad, but you know what? That's why we have these programs because we want to make people aware. But thank you. Anything else, Patrick, before we let you go? Got to go to Brian.
Uh, well, yeah, since Brian's coming up, I want to help Brian out too. There are a few countries that have problems with immigrants, European countries especially. But what you need to understand is that probably one of the main reasons why they have those problems is because of the way they treat their immigrants. They put them in ghettos. They deny them social services. They treat them like outsiders. And so, of course, they become a problem. So Brian is on the path of a self realization. What wrong word there? But if we're all treating these people poorly, they will become a problem. If we welcome them and let them become a part of our lives, they won't become a problem.
You know, Patrick, thank you for those words. I want to remind you that that is the same thing for our own born people here. When we treat people badly, we get bad situations. When we treat people like human beings, things not occur nicely. Thank you, Patrick, for your call. Let's go to Brian. Come on in, brother Brian. You're gonna be hot in 1 second. Well, maybe in 5 seconds. Brian, you're hot.
Yeah. What did the police do to 230,000 rape cases? They didn't investigate them at all.
I know it's terrible, isn't it?
None.
That is horrendous. What happened here in Harris County?
Yeah, a woman actually committed suicide because of that.
It's terrible. I couldn't believe when I heard that story. I could not actually believe it, Brian. That the police department, law and order, made selective choices to disregard the lives of many under the pretext that they have a personnel issue when they are the highest grossing people in this count in this city. They take more money than any other department. And that's why so many of us talk about not actually allocating funds where it actually works. And police should do policing and all the other stuff that needs other social work shouldn't be a police issue. So yeah, we should move a lot of the police budgets over to agencies that actually do the work. And it seems like you just came out with that answer for me.
Yeah, you mean like the fire department that
Yeah,
was
that
voted in?
yes, sir, yes, sir. And I'm glad the fire department got the raise that they deserved, aren't you? With that program as well.
Yeah, weren't they supposed to get that raise like what 5 years
Yes,
ago?
we
But the
voted
government
to.
said no.
Yes, we voted to give them that raise, and
Why?
along with Turner and others, they decided that again, all of this is dirty politics. I am with you there, brother. I want my first responders to be paid, and I not only that,
Okay, you
I
there?
think that the firefighters are just as, if not
There?
more important than police officers. Well, just as important as police officers, don't you
Hey,
think
can you
so?
hear me?
Yes, I can. Okay, Brian, I don't know what happened there, but let's go to Pamela. Pamela, come on in.
Good morning. I just wanted to ask you to dedicate a show, a program about this APAC group, how that working behind the scenes, long-term planning to turn us into an authoritarian state. I would love to hear you have somebody that's, authority on it. I know you know a lot. Maybe you can do it. But these
Well,
guys call themselves Republicans that are poor. They need to hear this.
you are APAC. I've written stories on APAC, and what I've called APAC is a clear and present danger to America. Right now, they are in the process of anybody who asked for a ceasefire or who asked that Israel stop doing what they're doing in Gaza. They are primarying them. They're investing over 100. Listen to this, Pamela. They're investing over $100 million to get rid of progressive people and Republicans who don't toe the line. Think about that. A entity funded by foreigners are controlling our politics.
Fanatic. They're fanatic. It's about ruining any kind of democracy that we have still left, that we have left.
Yes.
And these people that keep voting against their own well-being, like you say, whether it's health care, Social Security, or whatever, they need to understand that these people don't give a damn about working people.
Right.
Anybody that says they're Republican is poor, I have to keep scratching my head.
Well,
But anyway, thank God for all
thank you,
do.
Pamela. Thank you, Pamela. I really appreciate you.
I hope she's better.
Yeah, she's getting better. Thank you very much for that, Pamela. Thank you so kindly.
Bye-bye.
Bye-bye. And Pamela is so right. And let me tell you what my approach is. My approach is to talk to our brothers and sisters that don't quite get it yet. It is not to down them. It is to talk to them. And I am willing to do just that. All right, Brian, we dropped you accidentally, so come on back in, Brian. Sorry about that.
Okay, I know you have other callers. You do know that my wife is from Beijing, China.
You told me that.
Legally,
you told me that.
Yeah, legally through the immigration system. Okay, and she's been treated very fair. She's been treated very, very fair. From her home country, at the age of 16, she built tank traps around the city of Beijing. So, you people that want communism, please let me know. I'll talk to you about communism.
Okay, Brian, stop for a second. I normally don't interrupt, but since we're low on time, I just want to ask you this. Why did you just immediately transition into communism? Do you first of all, hold on, Brian. You listen to my show. Do you think I want communism?
No, I don't know what you want.
Okay, well, I know. Well, you keep listening to the show, and you'll see that what I want is exactly what you want. Okay, but because of our outside forces, you think that somehow we progressives are your enemies, when we are just looking out for what's good. We don't want some crazy system where people don't have their rights to do things. That's not who we are. That's not who we are. And I tell you the one thing that I saw that I'm seeing with you, and you tell me if I'm right or wrong. But I think initially, as you were calling this show, you just thought that we were out against just everybody like you. Okay? And I think, and tell me if I'm right or wrong. Tell me if I'm right or wrong. Hold on. I think you are seeing now that that's not it at all. We may have differences on certain issues, but both of us want a good America. Don't you believe that?
Do I believe that?
Yes.
I'm probably, yeah, everybody wants a good America.
And do you think?
But
Do you think?
socialism or communism is not the answer.
Say that again.
Socialism or communism is not the answer.
But again,
Doesn't
you
work.
know, wait a minute. Once we agree that both of us want what's good for America, right? If you and I agree that we want what's good for America, shouldn't the next step be, all right, Brian, let's you and I, you think that you are so much different than I am. You think that, right? Let's start going over one policy after a policy. You see, it is easy for us to go ahead and say, socialism, you're socialist, you're communist, you're fascist. It's easy for us to just call those words out, right? But what is it's hard and requires some thinking is for you and I to sit down and say, okay, let's talk one policy after another. Do you want this your all people to have this? Yes or no? You may say, well, I want that, but we can't afford it. And then I say, all right, how can we possibly afford it? This is what's happening. That is how you come to conclusions, and that is what they try for us, you and I, not to do. They don't want you and I sitting down and having a cup of coffee. When I say they, I'm talking about our plutocracy, our oligarchy. They don't want us sitting down and having a cup of coffee and going over things as regular human beings, regular Americans, talking about what are the solutions and how do we pay for it. They don't want that, because what happens then is we get a fairer country. Fairer meaning FAIR country. Okay? So what I'm telling you, Brian, because I've seen some come around in you, what I would like us to do, and I'd like the people that are listening, is stop looking at the other side as just how being inherently evil, and look at them and say, let's get to that space where we can actually start to have the conversation. Do you follow what I'm saying?
Yes, but you need to do the exact same.
I agree with you. I agree that I need to do the same thing. And I think, Brian, I think if you want to be honest, every time you call into this show, you get a platform to speak. We listen. I agree with you sometimes. I disagree with you sometimes. Well, most of the times, actually, when it comes to some of the stuff that you say, but love you anyway. But we talk. Don't you agree?
Yes.
So, and that is where we need to be as a society, sir. I want us to be, you're my friend, okay? I don't want to sit down there having enemies. It's too damn painful. So, you keep hearing, you keep hitting us up. You keep giving us hell, and I'll give you hell back. But we're talking, and we enjoy each other. So let's keep doing that, brother. I got to go to Harry again. So thank you, brother. We'll talk tomorrow.
Good weekend.
You too.
Yeah, have a good weekend.
All right, let's talk. Let's talk, Harry. What's up?
Hello, friend Egberto Willies and
Yes,
Howard
sir.
and Jack. And the other thing I was going to comment on is what Howard said about Deborah Arnie Arneson. I did hear most of her show this morning, and kudos to Pamela. She's right. The Arnie Arneson also mentioned on her show about APEC and the Broads wanting to defeat the Broad Squad and the rest of the progressives. She also mentioned 109 congressmen who won't toe the line, Republicans, they want to get rid of because they're talking against Israel and the things that Israel has been doing to the Judean people over there in the Gaza. And so,
Harry, can I interrupt for a second? I want to interrupt you for a second, just for sensitivity issues, right?
Yes.
There is a special thing with Israel, right? And how Israelis have been meant to feel. And I don't even want to. I want to use the right words. So whenever I'm trying to learn the language, and I'm not talking about Israel. I'm talking about Netanyahu and his IDF and the right wing who are inflicting these things. Right here in Houston, I are a lot of Jewish folks that I work with, organizations, etc., friends. that agree with everything that we have to say about Gaza, etc. But there is one sticking point, and that is they don't want this accompanied by anti-Semitism, which a lot of times get involved. So we have to be, it's not Israel that we're talking about, it's Netanyahu and his ilk that we're talking about. Continue, my brother.
That's who I'm talking about. I'm talking about Netanyahu and the people that believe in Netanyahu's ideology.
There you
are
go.
Jews
Thanks, brother.
who do not believe in Netanyahu. One of them, I have an attorney up in New York that's working on a case for me. She's voting for Dr. Cornel West along with her husband, just like I am, because she thinks people like Netanyahu need to be out of office over there because she sees him as a grifter and just a murderer. And he's not in Israel for all people over there. And that's what we need. And as far as Brian's concerned, what you're talking about, Egberto, with Brian, is we need inclusionism for everyone. Right. That's what we need. We don't need, as you mentioned on this show all the time, we don't need most of the money going into the hands of the few. That's why we got to vote in more progressives, have a Democratic
Harry,
Senate.
hard stop. Thank you very much. You got 2 bites at the apple today, brother. Thank you. And you keep listening, you keep calling. All right? Gotta go. All right, let's go to the studio.
Folks, just be aware of Project 2025. Read up on it, listen to it, get the information, find out what it's all about. I think you're going to be totally shocked at what they're trying to do. And that comes along with a vote for the Republican Party. So there you go. Jack, what you got?
Yeah, people blame the right, people blame the left when corporate greed is the underlying problem driving these oppressive policies.
Rats,
Grinches.
Those rats.
And actually, I think Jack just nailed the entire show, and it's what we just tried to talk with Brian about. It is the external forces that are keeping us apart. We've got to fight together to beat this force. I want to welcome Gatlin Combo, who says, these callers sound like they're a bit older, but they're progressive. This is awesome. Thank you for that. Gatlin, yeah, a lot of our callers are older because they're the ones who are going to be able to get up at 6 a.m. and not have to take care of the kids and do all these things to go to work. So we have a lot of listeners of all ages, but yes, a lot of the callers, because they have the wherewithal to do so, are in fact older. But anyway, folks, we got to get out of here. I want to thank Howard and Jack for the great work always being done. I want to thank the callers for always enlightening the show and making it a better show. I want to thank the people we interview, and I want to thank all you listeners. Love you all. My name is Egberto Willies. This is Politics and Right, and you guys know how I end this baby. I am what? Out.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number 1, subscribe to our channel, and number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.